I'm Iria Grande. I'm a medical doctor specialized in psychiatry, and I work in hospital clinic from Barcelona. And I'm also an associated professor of psychiatry in the University of Barcelona. I had the opportunity to participate with some colleagues of mine in a brilliant presentation about the functioning assessment of bipolar disorder and schizophrenia during the ECMP Congress. And I would like to summarize some of the ideas that we were commenting in these talks. One of the main issues in the assessment of our patients is that we have been neglecting all the functioning of them. That's to say, how they manage in their daily life, so as going shopping, how do they manage with personal relationships. We were only focused on how treatment showed an improvement according to a clinical improvement, how they could get the remission of symptoms, but we have always neglected how our patients were functioning in their daily practice. Maybe that was because at some time ago the treatments were not so efficacious, so it was kind of difficult to get a higher target. But I would say that we are in a moment that we can think about further targets so as to improve the functioning of our patients and their quality of life. And most of clinical psychiatrists have doubts about how to manage and assess functioning. There are two ways to assess functioning, according to an objective and a subjective point of view. I may say that the most clear one and the most commonly used in the studies are the objective measures. And according to the way how we do it, we'll use one or another scale. The scale that assesses the performance-based skills is the UPSA. That is the brief University of California, San Diego Performance-Based Skill Assessment. And it consists of making some exercise to the patient and see how he manages. And most of these exercises are based on their daily practice. So as, for instance, to have a look, to a receipt, and know if that patient understands the content of that receipt. Another way to assess objectively the functioning of patients is through an interview, our clinical interview in our clinical practice. That is done by the FAST scale, that is the Functioning and Assessment Short Test scale. It's a really short scale, and just nearly with 15 minutes you can fully assess the functioning of our patients. Another way to assess functioning is by asking to our patients about their feelings, about the way they manage life. And there's a scale that it's called the Sihan Disability Scale that tries to assess these subjective and self-report measures of our patients in their functioning. As we know in our clinical practice in the bipolar disorder team in Barcelona, that it's not easy to assess functioning in our patients, we developed our own scale that it's called the FAST scale, that it's the one that I previously said, that it's based in the interview of the patient. The functioning assessment short test, it's divided in different domains. It consisted of 6 domains. One is about autonomy, another one is about occupational functioning, the third one is about cognitive functioning, the fourth one about financial issues, the fifth one is about interpersonal relationships, and the last one about leisure time. As you can see, each item is about key issues in our daily life, and it's a way to assess the global functioning of the patients in a common day. The higher the score, the worse is the functioning of this patient. And by each score attained in each subdomain, we get a global score, and we can assess the global functioning of this patient. What are the pros of the FAST scale? It's really easy to apply. While you are interviewing the patient, it's really easy to apply it while you are interviewing him, and while you can easily get the subject point of view or functioning that patient has. It's important to assess the last 15 days while you are doing this interview. And the big point is that you are just only assessing functioning. There are some scales that, apart from assessing functioning, also assess clinical improvement. So that's a good scale just for assessing global functioning, and even more if you want to assess different domains of that functioning. It can be easily done just by studying the previously mentioned subdomains. How do we assess the scores that we get in this scale? The most important cutout is 11. When you get a score that it's higher than 11, it means that that patient has a functional impairment. If that patient scores between 20 and 12, that patient has a mild impairment. If that patient scores between 21 and 40, that patient is suffering a moderate impairment. And if that patient scores between 41 and 72, that patient is suffering a severe impairment. So just by administering the FAST score in 15 minutes, you can get a global idea of how this patient is functioning in their daily life. So thanks you very much for your attention, and I hope that the FAST scale is going to be useful for you.